Good afternoon, everyone. I'm Matthew Traynor, Chief Exec of Oxleas, and welcome to our penultimate Oxwide of 2020. And what a year it's been. We've covered a lot of ground this year, starting this off in the middle of the first wave of the COVID pandemic and continuing throughout. And it's been great to hear feedback from so many of you. You're finding these updates a really helpful way of keeping in touch with you. We've only got one more this year, which will be next Friday, and that'll be a bit of a Christmas roundup. So I just wanted to say one or two quick pieces of trust business. As you'll be aware, we've got the COVID vaccine slowly making its way out through South East London. Great news to see. And this week, the first NHS staff and vulnerable over 80s were offered the COVID vaccine at Guy's and St Thomas's and at some of our King sites as well. We're waiting to find out when we'll be able to offer that sites to you, to our Oxley staff and to the people we care for in the community through Queen Mary's and through primary care and other settings. But for now, the key message has to be look after yourselves and remember that guidance about hands, face and space. We know how we can protect ourselves against COVID by taking those sensible measures. And actually numbers in London are on the up. London now is the region in the country with the highest COVID rate. And that last sort of period of 2-week restrictions, or the lockdown as we were all calling it, it hasn't really touched the side. So we've got to stay careful, look after yourself and look after your loved ones by doing the things we're supposed to do. We'll find out more next Tuesday about whether London is going to go into Tier 3 along with Kent. And I know a lot of our staff live in Kent and some of us work in Kent as well, at our Kent prisons and other sites as well. So keep an eye on that news. But for now, just remember those important messages we've been saying all years long. Wash your hands, wear your mask and take care of yourselves when you're at work, when you're around your colleagues and when you're going home to the families, and make use of those tests we've given you all to make sure that you're looking after yourselves. All right, so with no further ado, we've got some great fun coming up this evening in the shape of a quiz that our great friends at Charlton Athletic are putting on for us. And I'm delighted to say, in a bit of an Oxwide first, we're joined by one of the country's sort of top flight footballers, Mr. Scott Minto, who's going to be our host this evening, and also by Carl Krauhaus, who many of you will know well through the years of fantastic work we've done with our partners at Charlton. So welcome, Carl and Scott, to Oxwide.
Thank you, Matthew.
Good afternoon. So, Scott, so tell us a bit, for those people who don't know about your football career in the top flight, tell us a bit about your association with Charlton and then a number of the country and Europe's other top clubs.
Well, yes, I started as a professional footballer in the Charlton Academy, made my debut for Charlton at the old Den at Millwall. So that was welcome to first team football. Then went on to Chelsea, where I won the FA Cup in 1997. After that, I moved to Benfica in Portugal, which is historically the biggest club in the country, and is absolutely amazing to play in front of 60 and 80,000 people on a regular basis. Played Champions League for them. Moved back to London and played for West Ham, and then I finished my career up in South Yorkshire, Rotherham United, which is a real throwback to how I started my career and the way they did things. I won't bore you with it now, but it was a fantastic way to finish my career. I really enjoyed it. And for the last 10, 15 years, I've been in the media, either as a pundit or presenting, up until recently Sky Sports, where I did the Spanish football and also the EFL and Carabao Cup. So here I am right now. I have to say from the very beginning, Charlton, I suppose, was like a first love for me. Everything went so well there. I really enjoyed the time, and every time I've been asked to do anything for the Charlton Athletic Community Trust, I've been more than happy to do that. And we had some great quizzes in the summer, so hopefully tonight will be a lot of fun as well.
So tell me a bit more then, Scott, because during the first lockdown, you were very active supporting Charlton Athletic and the Community Trust, weren't you, with a number of quizzes? So this won't be your first digital quiz this year, will it?
No, and please don't complain if the questions are either too hard or too easy, because I'm not doing the questions myself. I'm just reading it out. Don't shoot the messenger. But no, we did it in that, Carl and Jason Morgan at the Community Trust at Charlton came to me and said, look, they know I have done things in the past. I also want to help out whenever I can. Would I be willing to do this over lockdown? And you know what? It was really good fun. And I don't know whether it was timed to perfection, but it was on the day where, and we finished probably about 15, 20 minutes before, we all went outside and cheered for the NHS as well. So, I made sure I got the 3 kids. They're still very young in primary school. Get your pots, get your pans, get your spoons, the loudest possible. I've finished now. We can go outside and cheer the NHS for 2 minutes. And it was really good fun, actually. And I think everybody connected with Charlton, really got into it, took it on board. We learned things as we went along as well. So certainly by the end of it, I think everyone was having a lot of fun.
And like many of our staff who've had to work from home or to change their working patterns this year, Scott, you weren't just doing the quizzes in the football, were you? You had a couple of your own teaching duties to look after as well.
Oh, don't bring it up, Matthew. I was hoping you wouldn't say that. I was a teacher for 3 months, like many parents around the country. What we tried to do in the beginning was, make it like a little bubble and tell them what they needed to know, but not tell them what they didn't need to know. We created a school badge, a school name, homeschool primary. And for the first couple of months, it actually worked. I mean, fortunately, I wasn't working. Unfortunately, there was no football, but I was around. My wife is a dentist, so she was around as well to help out. So we kind of split it between the two of us, 3 kids, zonal marking rather than man-to-man. And the last month, though, I have to say, was tough. There's a point where the kids look at you and say, "You're not my teacher, you're my daddy," and I'm going to start, saying a few things back to you. But look, they did their best. We did our best. That's all we can do, and we got through it. So there's a time it'll be interesting. We discussed just before, Matthew, about how our kids will look back at this time. So hopefully they'll look back at it with fond memories of what really has been a horrible year.
And those of us at Oxleas, we're very grateful, Scott, for the support you're giving us through the quiz tonight, and you've been helping out with some of the visits to the Valley as well. But of course, you've got a personal connection with the NHS as well, haven't you? And those of our staff who work down in Green Parks and at the Prue in Orpington might come across a member of the Minto family.
Might well do, yes. My mum, Barbara, is a mental health practitioner there. I don't think she'll like me saying this, but I'm going to say it anyway. She's 75 next month. And, but she's 35 in terms of the mental age, very sharp, wants to keep doing things, wants to help people. It has always been very much like that. And I think it's helped me, keep my feet on the ground as well, really. So, yeah, she's at the Prue 2 days a week, really enjoys it. I just spoke to her about half an hour ago. She said, make sure you put on a nice shirt. So hopefully she'll be happy with what I'm wearing right now.
And what can people look forward to in the quiz tonight, Scott? Any clues, anything we should be off Googling before 6?
You know what? That's exactly why I'm not going to tell you, Matthew, to be honest with you, because you cannot Google, you cannot cheat. We're trusting on everyone to look. This is about a bit of fun. You can have competitions within your family or within your bubbles, or even text your family and friends to see how you're doing. We're going to give you a number as well to text in to say, to tell us where you are, and by the very end of it, see who was in the top 3. 4 rounds. One is a sporting round, you won't be surprised to hear. Another one is a family round as a general knowledge. And look, I think it's one of those where you either know or you don't know. And I'm certainly not giving you the questions right now to give you time to Google.
Okay, thank you very much, Scott. And we're really looking forward to that later. And I'll just ask Carl now. Carl, we're seeing some good numbers signing up for the quiz tonight. Is that right? You're on mute, Carl. Wish I had £1 for every time I said that this year. So.
Apologies, I've not got the experience of Scott on the presenting side, but yeah, it's been a really good response. Last count was half an hour ago. We've got over 140 Oxley staff signed up to join us this evening, which is brilliant. It'll be a great moment.
And Carl, of course, the Community Trust's been doing some great work this year. I mean, you've been fantastic partners of Oxley's for many years now. You had to change the way you work a bit this year to support people through the pandemic.
We certainly have, yeah. I mean, different projects have had to be adapted in different ways. We obviously, as a trust, were part of the COVID response in Greenwich heavily, and also in Bexley. But obviously, we've got ongoing concerns and ongoing projects which we had to adapt quickly to, for instance, your early intervention in the psychosis project that we deliver on behalf of you guys. We had to take to a virtual platform to make sure that those young people are engaged weekly. And we've been yo-yoing really back between face-to-face and virtual over the last 2 or 3 months, trying to see people where we can, but obviously just having to go in line with restrictions and lockdowns as well. But it's been really positive. Our staff have stepped up massively and continue to the best of their abilities really to provide services during this period.
And the quiz tonight is part of a number of things that the Charlton family are doing to support Oxleas and NHS workers in South East London, isn't it? Yeah,
it's a bit wider than that, actually. It's part of the London United Collaborative, which is a group of London football clubs. And all of us have been paired up with our local NHS partners. So for us, luckily, that was you guys. And what all the clubs are doing are finding unique and exciting ways of providing platforms really just for those NHS staff. Just a way of saying thank you for the efforts over the last 6 months. And actually before that, because we know you guys have delivered fantastic work before the pandemic. So we're lucky to be paired with you guys. We had 6 of your families to the Valley last Saturday. They all enjoyed their own bespoke tour around the stadium, and we got them in behind the scenes, and that was great. And then this is obviously the second in the series of events which Scott has kindly agreed to host tonight, which is the quiz, which is specifically for your staff. And it's just a bit of fun. Pour a glass of wine and come along and join us for the hour and then enjoy that.
We're looking forward to that. And I have to say, if you've met some of my colleagues, describing it as a bit of fun doesn't quite capture quite how competitive some of them can be.
So we're fine with that. And we're trying our best to announce the live winners tonight. But obviously, the increasing numbers may mean we've got to do that maybe after the quiz on social media. But we're aiming to announce them live. So maybe it might be you, Matthew. If you get the family behind you, you might have a chance.
Yeah, as long as you're asking about Scottish First Division football, I might have a chance, Carl, but I doubt that's going to be the case.
Expert on super, yeah.
Just about. Well, look, I just want to say thank you to Carl, to Jason, Terry, all the guys at Charlton have done such a great job supporting us this year. And also thanks very much to Scott, our first FA Cup winner on Oxwide, hopefully not the last. And we very much are looking forward to the quiz tonight. Thank you, gentlemen, and all the best to you and your families. And we'll see you at 6:30 this evening.
Same to you, Matthew. Thank you.
Thank you, Matthew. Pleasure.
Here's Scott. Thanks, Carl. Bye-bye.
See ya. Bye-bye.
Okay, so that was brilliant, and we're really looking forward to that tonight. If you haven't signed up yet, have a look on the Ox, and there's information there about how we can get onto it. It's fantastic to have, someone of Scott's reputation, and the support of Carl and the guys as well. And a really big thank you to all the NHS staff in Oxleas who've been working tremendously hard throughout the pandemic this year. And I'm really looking forward to it tonight. I'll be joining them with my kids and seeing what we can get out of the evening. So that's brilliant to hear from Charlton there. Now, next up, we've got a film for you about the EObs project, which we've been rolling out across Oxleas. Then we're going to come back and hear a bit more about our apprenticeship programme as well. So I'll ask Mr. Steve Cooksley to run VT for us, and I'll see you all in a moment. Thank you.
Hello, I'm Sally Bryden, and today I'm joined by Sue Vickery, Project Manager, and Emma Lane, Project Support Officer, to talk to us about the EObs project that's been developing over Oxleas. Sue, maybe you can explain to us at first what the EObs project's about. What does it involve?
Certainly, the EObs project relates to collecting observations for patients on the mental health and physical health wards. Currently, all of this work activity is undertaken via paper, and the Trust wants to move to a more digital way of working, and we're looking to record these observations electronically. And this will be a way of doing it at the point the observation is undertaken by the member of staff. So they'll do it in the immediacy of the moment. So that will actually mean that we'll reduce all the paper across the Trust drastically, because currently there is a paper record for every single observation that is undertaken. And this information will be readily available within Rio, which is the system we use, and clinicians can use this information to base some of their decisions on when helping to care for patients.
That sounds great. Emma, what stage are we at with the project?
So currently we are in the final stages of completing the first phase, which is the therapeutic observations. So we now have all 22 mental health wards live and up and running and recording their therapeutic obs electronically. And then we'll shortly be moving over to phase 2, which is the physical health, and capturing those electronically.
Thank you. I guess it's been quite a hard project to get underway. Sue, maybe you can tell us some of the challenges that you've faced.
Yeah, the project started some time ago, back in the end of 2018, so it's been a long time in the making. We had a product that we bought from the company that also provide Rio, which is Servalec. We've had a number of issues getting the product ready for the front line. We have been the first of type to use it therapeutically across the National Health Service. So we've done quite a lot of development work with the company themselves in building this element of the project. We were ready to go live at the beginning of the year, and we were drawing our plans up. And then a little chap called Mr. COVID decided to attend the country and threw all of our plans in the air. At that point, we had to revisit our plan, because the plan was we would go into wards, we would do face-to-face training with every member of staff, and we would also support staff directly on the ward by being on the ward with them. Obviously, that was not possible in the environment we were now in, so we moved reviewed training with the project group, which is a group of people that have supported us all the way through and helped us to come up with a plan, which was to then do a different type of training, and we've moved digitally to do training. We've used OLC training courses. We've also provided a key cohort of people from each ward with intensive training on EObs before they went live, so that they had a really good understanding of how EObs worked and what happened. And then in addition to that, when wards go live, Emma and I have supported virtually using MS Teams principally as our main mode of contact. We have found out during that process that the MS Teams usage or knowledge of how to use was quite limited in some areas. By the end of the first couple of days, they became very au fait with how to use MS Teams in terms of sharing documents with us, sharing screens with us, answering calls, setting up calls, sending messages. So I think we've had an added benefit that we didn't anticipate previously, which is that we've also helped wards to utilise other tools within the trust, as well as taking on a brand new process, a brand new digital process, which wards have never experienced before.
There's been a lot of learning all round by the sounds of things.
Yeah, we've had a lot of benefits we hadn't anticipated at the beginning.
Yes, yeah. And Emma, maybe you can tell us some of the other things that have helped the project to be successful.
I mean, the overriding thing has been the teamwork and the determination for the project to succeed. So we knew kind of that even though COVID arrived, we still wanted to continue with the project. So the project group as a whole came together and we kind of figured out other ways of delivering the project. I just want to thank everybody, who has helped and supported Sue and I alongside to get it up and running. So it's just a lot of teamwork went into it.
That's great. Now everybody working together. So Sue, what are the next steps in the project?
Well, as Emma mentioned earlier, the next steps is to move across to the physical health. But at the moment, we only went live with the last wards last week. We have a number of things to finish off before we sort of move away from the therapeutic observations into the physical health side. Things like moving things to a BAU type environment. So we need to do a bit of work on that. We hope to be moving across to the physical health in the new year. We've had a few early discussions and we do have a meeting soon, and we are currently sort of standing the right people up to talk about physical health, and we will be engaging with people from Meadowview in particular and also Elson Community Hospital, because those are the people who are going to be mostly affected by the changes that we're proposing for physical health. It still will impact the mental health wards, but not in the same way. So we do want to engage with those people. So those are the sort of next areas we're looking at moving into.
Thank you. Well, we wish you both every success for the next stages of the project. Thank you very much for joining us today.
Thank you very much for your time.
Very much for your time.
Thanks. Thank you, Emma and Sue. And now we're going to hear from Christine, who can tell us a bit about how the EObs has been working for the staff on the wards.
So the new system has been rolled out to all the mental health wards within the organisation. I've visited the forensic ward and I was in Oxleas house when it was rolled out to Greenwich. And basically staff loved and embraced the new change. It was very easy to use and they found it really efficient and user-friendly. But so far so good. The staff are happy. Patients are aware what the staff are doing with these devices. So all the work has happened. I think Emma, the two Sues have done worked really hard to engage the nursing teams and the patients to introduce EObs.
And welcome back, folks. And a brilliant project, that EObs, and it's part of the work we're doing across Oxleas to improve our access to the use of digital technology that supports us in doing our job more smoothly, efficiently and safely. And it's been great to see some of the people who are involved in making that rollout happen. This year we've embraced digital like we never imagined we would, and it's great that as a trust we've been ahead of the curve, I think, and getting used to this as a way of working. So I'm now I'm delighted to be joined by Nigel Hogg and Becky Symonds. And Nigel, tell us about why you've joined us here at Oxleas and a bit about the work we're going to be doing with apprentices next year.
So part of our government targets is to actually have 2.3% of our workforce as apprentices, and unfortunately we've been slightly lagging behind in the past on it. We have had about 90 members of staff on apprenticeships to date, but we've only got about 70 live at the moment, which obviously is just slightly under target, which is but we are getting there with another 25 joining in the new year on things like healthcare assistant apprenticeships, podiatry, and occupational therapy. So they are growing, as well as some in business admin and HR.
So tell us, for those of us of a certain age, apprenticeships probably mean something slightly different. I mean, I associate it with working in a bakery or learning how to change an air filter on a car, that kind of, not very successfully, I have to say. But it's a much more sophisticated pitch these days, isn't it, Nigel?
Yeah, it is. I mean, thank you, because that's where I actually started my life out, as a person changing oil filters. So I was your typical apprentice back in the 70s for my sins, working in the motor vehicle industry. But apprenticeships these days are a wide range of apprenticeship standards that are a legal framework. So you can't call yourself an apprentice unless you are actually on a government standard. And these last between 12 months to 6 years. So some apprenticeships are up to 6 years in duration, runs from a level 2 up to masters. And we actually in Oxleas have that whole spectrum covered. So we have some of our staff on level 2 apprenticeships, and we have some staff on level 7 masters apprenticeships. But it's a way of learning a skill, new skills for a job role that you need to be upskilled in or required skills in. It's government funding, and the very fact that we pay a levy for it, and that levy can be paid for the apprenticeship training. And so we're engaging more staff all the time. We're also hoping to introduce a work experience type element to it as well.
And it is, I mean, we're trying to bring in more school leavers, work experience, but it's not just for school leavers, is it, as well? You know, it's a really great opportunity for people at a range of stages in their career to get into something new.
Oh yeah, I mean, there is no age restrictions. For Oxleas, we pay the same whether you're 16 or whether you're 65. And ironically, not a lot of people realise it, that there are about 10,000 apprenticeships each year for over 65s. So everyone thinks, oh, it's for 16-year-olds, but it's never in modern times been for 16-year-olds. The biggest chunk of apprenticeships have been for 19 to 25s. Most of Oxleas are, you look at me, you know what mature is, but if you look at the staff, they are for not the young 16-year-olds, if you know what I mean. They are for our adults that are already employed at Oxleas to date.
Yeah, I mean, I've met a number of our apprentices, and I think they're making a fantastic contribution to the work of the trust. And of course, Nigel, you and I have talked about our ambition to look at making the vast majority of our entry posts in apprenticeship, because as a local employer, a big local employer, we really need to play our part in creating opportunity, particularly once the unemployment from COVID starts to bite.
Yeah, we're working. So I come from an college stroke high university background before I joined Oxleas. I only joined Oxleas back in March. And there is a big appetite for jobs in the NHS, and the local providers, you know, really, really want to work with us to fill some of the entry level posts and train up local people. And generally, if you train up someone locally, they do an apprenticeship, they stay with us for about 5 to 6 years on average. So there's a good retention tool afterwards, as well as training up our present staff and getting them up to where we require them.
And I'll come to you in a minute, Becky. But last thing, Nigel, I saw the announcement we made about the work we're doing with London South East colleges as well around the vaccination programme. And this is a really great opportunity, isn't it, for any folk out there looking for a way into the NHS?
Yeah, so we're working with South East London College. They are running some pre-employment programs. Again, because I come from FE, I know that FE can do these kind of schemes very well. They are also, whilst they are doing the pre-employment checks and doing some training, they're also trying to embed some of the values that we've got at Oxleas, so that when people come to us, we know that they've had a slight amount of screening. It doesn't guarantee them a job, but it does guarantee them they're going to have the right attitudes and the right skills and behaviours that we're looking for when they apply. That's
fantastic, Nigel. And I'd urge people to keep an eye out for the opportunities that Nigel's helping us create. And it's great to have someone with that understanding of further education at the Oxleas table, and look out for more news in that direction over the course of 2021. Now, Becky, you're fresh from the nursing conference this morning, aren't you? How was that?
I am indeed. It was really, really good. I think it was really successful.
Yeah, giving Steve Cooksley more to cope with as our comms mastermind. So.
I think we've made him an honorary nurse this morning.
and so talking to nursing, then you're our lead, aren't you, for nursing apprenticeships as well? So tell us a bit more about that, Becky.
So we make up the majority of the apprenticeships in Oxleas in nursing, and largely that's due to working very closely with Nigel. I mean, we have healthcare support workers who are starting the level 2 and the level 3 apprenticeships. We've got 18 of those. We've got 24 of our staff nursing associate apprentices, and we've got 7 who are doing the nursing as well. And then on top of that, we've got quite a few who make up the masters, of which I'm one. So I'm doing an apprenticeship in a master's course.
And what are you studying as part of that? Tell me a bit about what's involved in that.
Oh, so it's management and leadership. So we are looking at things like project management, strategic management, all kinds of things in line with business and how that fits into Oxleas and our roles in terms of moving Oxleas forwards in the future.
So these apprenticeships are really broad in scope and really offer people a fantastic opportunity to get ahead in their career, don't they?
Oh, they really do. And one of the things that we've worked really closely with Nigel is, as we were going around and we were talking to people about the nursing associate apprenticeship, which is an amazing course in its own right, we realised we had a lot of staff that wanted to get onto it, or the nursing, but didn't have the qualifications, which is why we've now got the level 2 and the level 3 apprenticeships for the staff who need maths and English or a diploma, so that they can get onto those courses too. We're really thinking about how we're going to grow our own staff in Oxleas and how we can really support people that want to become nurses to be nurses.
And I mean, I think one of the things I love about Oxleas is the number of times you meet someone and they're part of a sort of family sense about the trust. You know, there's people whose parents have worked for us. There's people out there who are looking to bring their children who are leaving college or university or school through into employment in the trust. Yeah. And I think, you know, one of my happiest moments in one of our inductions was one of our physios who remembered seeing a member of Oxleas staff doing a talk to her sixth form when she was in Wilmington at school, and she's now trained and become a physiotherapist. And that's very much what we want to encourage people to look at just now, isn't it?
It is indeed, and that really resonates with me because that's what I've done as well. I've gone back to schools and I go to colleges and we talk about how to get into nursing, and Oxleas, we're always promoting Oxleas and how we can really kind of broaden ways to get in, because obviously nurses come from a variety of backgrounds and we need skill sets from all types of and walks of life. So it's just an amazing opportunity to get in and get those skills that you need.
Are you going to be joining us for the Scott Minto quiz tonight, Becky? I know you're pretty excited to be following him on the video today.
Well, it's just because I used to go to the Charlton Athletic when I was a child, so it's really bizarre to see him on the screen. But yeah, I'll be joining. Yeah, definitely.
Right, fantastic. Well, look, thank you very much to Nigel for bringing his knowledge of this into Oxleas. The trust really benefited from it, and thanks, Becky, for the work you're doing around the nursing apprenticeship. Really important opportunity for us to bring the sort of next generation of Oxleas people through and create some opportunity in a time when jobs are getting increasingly tough to come by. So thank you very much to both of you. Right, so that's Oxwide for today. If you haven't signed up for the quiz yet tonight, get yourself onto the Ox. And have a look. It's there in the news carousel, or if you search quiz or Scott Minto in the top of the bar, you'll find your way in and you can sign yourself up and, you know, get the popcorn in and have a go tonight, and let's see how we get on with that. Our 12 days of Christmas emails have still been coming out with a chance to win a hamper. And of course, as we're looking ahead to next week as well, there'll be a number more Christmas activities to celebrate the end of what's been a really tough year. Next week will be our last of Oxwide of the year, so we'll have a bit more to say as a bit of a review of the year at that point. But for now, thank you as ever to Steve for manning the desk. Thank you to Becky and Nigel for joining us. And thank you to our great friends at Charlton, Carl, and looking forward to tonight's quiz compared by Mr. Scott Minto. Thanks very much, everyone. I'll see you this evening for the quiz and have a lovely weekend. Bye-bye.